Okay, the first organism we're going to talk about in the Enterobacteriaceae family specifically is Escherichia, and obviously Escherichia coli. Okay, you know most of the genus specifics here. They're gram-negative rods, they're lactose fermenters, and we're going to focus on E. coli or Escherichia coli. Now, most of these we've talked about in comparison with other organisms, so you know they're facultative anaerobes, and you know that they're oxidase negative. The reservoir for E. coli is the human colon, so it's part of our normal flora. It may colonize the vaginal mucosa or urethra as well, and we have seen specific instances of E. coli that have been acquired through contaminated beef, and that would have been through bovine feces contamination. All right? So different reservoirs with some of the different diseases we're going to talk about. And the first thing we want to talk about, as far as transmission, a lot of the times, and I mentioned this early on, the transmission for E. coli is endogenous. Remember, it's in the colon. It somehow gets lost. It's in the urethra. It's really not sure how it got there. So it's going to hold on with its pili so it can resist the flow of urine coming at it. Okay? Fecal, oral, so you're going to eat something contaminated with feces. Maternal fecal flora, this is going to happen in the case of neonatal meningitis. And then your enterohemorrhagic strains are from fecal contamination from cattle. And that's the classic example of EHEC. Now, I'll talk specific pathogenesis listed under the different diseases because there's several different disease presentations for E. coli, and that's going to vary disease from disease. So, urinary tract infections, E. coli is the most common causative agent. So what that means is if I give you a vignette and I say you have a 25-year-old female that presents to the ER with frequency, urgency, hematuria, and dysuria, and I don't give you any culture, any gram reaction, I don't give you anything, I just say, what's the most common cause? It's always going to be E. coli, okay? You're always going to want to go with E. coli for the most common cause of UTIs. Now, the transmission, as we mentioned before, is endogenous. So here's the perfect example where it gets lost, not in the colon anymore, finds itself in the urethra, and now sticks out its pili and grasps on, okay? So one of the most important virulence factors here for UTIs is going to be the pili, okay? Now, what are some predisposing factors to infection? Females typically get urinary tract infections more often than males, and the simple reason for that is that our urethra is smaller. So it doesn't have far to go. The organisms can easily then get dislodged from the colon and find their way to the urethra. Other issues that can lead to UTIs, of course, and we've talked about this before, are the urinary catheters. What the catheter does is it bypasses that whole flow of urine. So the urine can't flush out the urethra, makes it very easy to get urinary tract infections. Now you are going to treat urinary tract infections, and drugs of choice for UTIs, typically you'll start out with a sulfonamide, but there is some allergies to sulfonamides, in which case you would go with a fluoroquinolone like ciprofloxacin, for example. Okay? So UTIs, E. coli, most common cause. Next disease we're going to focus on is neonatal septicemia and meningitis. We said that this was second most common after group B strep. The infant acquires the organism from the maternal fecal flora, so it gets contaminated as it comes through the birth canal. What's going to be an important virulence factor here is the capsule. Remember, I gave you that example earlier. It has the K1 capsular serotype. Okay? And that helps it get across that blood-brain barrier. Now, endotoxin, of course, is going to be significant for E. coli as well because it's going to what? Trigger shock, inflammation at that blood-brain barrier. The treatment for meningitis in this case is ceftriaxone. So remember, we said you're usually safe with a cephalosporin for treatment of meningitis. All right? Now, gram-negative sepsis, again, E. coli is probably the leading cause of gram-negative sepsis. It can be typically from an IV line. For example, a patient has a central line, gets contaminated with E. coli, and you develop sepsis. So the symptoms here when you get gram-negative sepsis, you go into shock, remember, you have the fever, the hypotension, and what is that a direct result of? The LPS. Specifically, if we really want to get picky, the lipid A. Okay, so the endotoxin is going to trigger shock. Definitely going to treat this, and again, your drug of choice here is a fluoroquinolone or a third-generation cephalosporin. All right, now we're going to enter into the realm of gastroenteritis with E. coli. There are several different types of gastroenteritis with E. coli. You have enterotoxigenic E. coli, enterohemorrhagic E. coli, enteroinvasive E. coli, enteropathogenic E. coli, and enteroaggregative E. coli. The two most important types of E. coli causing gastroenteritis, meaning the most clinically relevant and the most tested, are going to be E-tech, which is enterotoxigenic E. coli, and E-hec, enterohemorrhagic E. coli. Let's talk about E-tech first. First, with E-tech, you think T, toxigenic E. coli. The T can also stand for traveler. All right, so this is the major cause of traveler's diarrhea. Typically, we think about this when we're entering Mexico. That's probably one of the key countries that they're going to mention as far as traveler's diarrhea. You always hear the adage, don't drink the water when you go down to Mexico. All right? Well, I do a lot of lecturing, international. I've been down to Mexico, done a lot of lecture series down there, and the very last time I actually did not get around the E-tech, okay? So I was very careful. You know, you always think you can outwit the bacteria. I drank bottled water. I had no ice. I brushed my teeth with bottled water. I was very, very careful. But somewhere along the line, I ordered a burrito, and I was loving life, eating a burrito, and then I noticed some lettuce in the burrito. The lettuce was probably washed in water, contaminated with E-tech, okay? So now, I'm lecturing 7 hours a day with what? Voluminous, watery diarrhea. I challenge you to try that, my friends, one day. Basically, probably everyone heard my stomach gurgling from the front to the back row. I took a lot of breaks. I would come back from a break 5 minutes later, take another one, beg people not to follow me in the bathroom. And on the way home, the E-tech continued, and I had this on the plane. I did not make the people on the plane very happy, okay? So, voluminous watery diarrhea, I can't even imagine. Cholera is worse than E-tech. I can't even imagine, all right? Because this was bad enough. Lasted about a week, okay? And when we're talking about E-tech, again, we're talking about the cyclic AMP-inducing toxin. So you're going to get that net outpouring of fluid from the cell and that voluminous watery diarrhea, all right? So usually in that case, we're talking about the LT toxin, but there is a similar toxin that's heat stable that does things very similarly, but instead of hitting the cyclic AMP, they hit the guanylate cyclase. The net effect is the same, all right? Now, with E-tech, again, okay, another important virulence factor is going to be the attachment, all right? If you're an agent causing voluminous watery diarrhea and you cannot adhere, When that peristalsis and diarrhea starts, you're going to flush yourself right out of the gut. So the colonizing factor adhesins, the CFAs, are also important in helping the organism bind to the small intestine. Now, as far as treatment, again, like most of the agents of gastroenteritis, this is self-limiting. So you're really not going to use antibiotics, although they may shorten the duration of the disease. All right. Enteropathogenic E. coli, we're going to talk about as an important cause of gastroenteritis in developing countries. But what I want you to think about with the P, enteropathogenic E. coli, think that the P stands for pediatric because it's an important cause of pediatric diarrhea worldwide. All right? Now, that's really all I want to mention about EPEC. Enteroinvasive E. coli, all right, this is going to be an interesting one because what you're going to have to do is differentiate this from enterohemorrhagic E. coli. Both E. colis, both cause bloody diarrhea, but one's invasive and one isn't, okay? So, enteroinvasive E. coli is similar to Shigella in that it invades, you get an inflammatory response, and you get a bloody diarrhea, all right? Now, I'll give you a word of caution here. A lot of the times when we say bloody diarrhea, it's not just going to be bloody right away. A lot of the times it start out watery as a mechanism of the inflammatory response, and then it converts to bloody once the invasion and inflammation has really set in. We also call enteroinvasive E. coli one of the agents that cause bacterial dysentery, the other bacteria being Shigella. Okay? Now, there is another type of dysentery called amoebic dysentery, and we'll talk about in the parasite chapter, and that one's due to Entamoeba histolytica. All right? Now, the treatment for enteroinvasive E. coli, fluoroquinolones typically will help shorten the duration and clear that particular infection. Now, again, like ETEC, EHEC is also going to be extremely high yield, okay? Now, I mentioned EHEC before as the exception to the rule. So enterohemorrhagic E. coli is the only one of these agents that causes bloody diarrhea but is non-invasive. So we have the exception to the rule here. So let me go through a couple of features for you. Number one, it's the 0157H7 serotype. This is the serotype we mentioned when we were talking about the different structures, the different types of antigens you can see in this family. Now, how is it transmitted? Transmitted through bovine feces. The first real outbreak of this was when we had a lot of contaminated beef that hit particular fast food restaurants, and a lot of children were getting sick. The next kind of big wave of this was in petting zoos, all right? So you take your kid to a petting zoo, they're playing around with the animals, they don't wash their hands afterwards, they get fecal contamination, and what do? They put their hands in their mouth, and now they've just inoculated themselves with E. coli. Spinach was another big outbreak we had in the U.S. of EHEC. All right, so those are some of the means of transmission that we've had. The disease is interesting, okay, because in adults might typically get a mild diarrhea, okay, but in kids, EHEC is very serious. They will typically get the very bloody diarrhea, and what we're going to worry about is it progressing onto hemolytic uremic syndrome. Enterohemorrhagic E. coli causes HUS in children usually between the ages of like 5 and infancy. All right, it's got the most highest incidence, so less than 5 years old. What is happening is that the toxin that is causing the disease, which is an inhibitor of protein synthesis, the same as Shigella, okay, actually also binds to the kidney. What does it do? It interferes with protein synthesis. What happens then? Cells are beginning to die. We're starting to get necrosis. Okay? So Hus occurs with EHEC in children. What's another distinguishing feature? I said that this was the exception to the rule. You're going to get a bloody diarrhea, but it's not invasive. So think about it. Translate into what you're going to see, what you're not going to see. Okay? You do have bloody stools, but you don't have fever. You don't have PMNs or leukocytes in the stool because it's non-inflammatory. Okay? So keep that in mind. The toxin, as we know, is a Shiga-like toxin, works exactly the same as the Shigella toxin, and it does so by interfering with the 6DS ribosome. Now, it's non-invasive, so we don't have an inflammatory response, therefore we don't have a fever, therefore we don't have pus or PMNs in the stool. Right? The damage is done from the toxin. Now, the last important point I want to make is how you're going to diagnose EHEC. Okay? How are you going to diagnose EHEC when E. coli is part of the normal flora of the colon? Okay? Well, strains of enterohemorrhagic E. coli are actually unable to ferment sorbitol. Your normal flora E. coli, however, can ferment sorbitol. So one of the screens that you can do for EHEC is you put the organisms, you culture the stool on something called a smack plate. Not like this, although you may feel like you need one of those right now, but a sorbitol, for the S, McConkey, smack plate. EHEC will be colorless on a smack plate because it can't ferment sorbitol, whereas your normal flora E. coli will turn pink on a smack plate because it can ferment sorbitol. All right, and the last point here we've mentioned a few times, in the case of a child, especially one with hemolytic uremic syndrome, antibiotics are generally contraindicated because, again, you can make that child toxemic. You're releasing all of that toxin, and that's generally enough to push them over the edge, put them into kidney failure, and put them on a transplant waiting list. All right? So antibiotics are contraindicated in that case. Enteroaggrative E. coli is a cause of persistent diarrhea in developing countries, but with all of the other strains of E. coli, it's probably very low on the priority list for E. coli and gastroenteritis. Treatments for E. coli were all listed under the specific diseases, but in general, for gastroenteritis, we're not going to treat.